You may not think about your ovaries very often. These small, walnut-shaped organs are a part of your reproductive system. Eggs are created and stored there. The eggs are then released down the fallopian tubes, starting the monthly cycle that ends with either a period or pregnancy. Most of the time, the ovaries do their part on the reproductive team without you having to worry about them. But sometimes, cancer can develop there. Even though ovarian cancer isn't that common, it's a deadly condition. Ovarian cancer can be silent. It doesn't always signal to you that it's developing with any signs or signals. Some people don't even experience symptoms until the cancer has already grown and spread within their body. It's difficult to detect, often causing symptoms that are easy to brush off as everyday aches and pains. But these symptoms can be clues to cancer if you are tuned in to your body. It's important to pay attention to your body. If something seems off, reach out to your doctor. Some of the symptoms may seem like nothing, but they can be a warning sign of ovarian cancer. Abdominal pain. Having a stomach ache or feeling bloated may seem like nothing, but if this is outside of your normal, it's good to check out. Pain in your abdomen and pelvis can be a sign of ovarian cancer. Similarly, you might not think of a change in your appetite as something strange. You might run through a list of many reasons why this can happen. However, it can be another sign of ovarian cancer. If your appetite has changed, or you notice that you feel full faster, this could be another sign that something isn't right. Abnormal bleeding. This is any bleeding or vaginal discharge that happens outside of your typical menstrual period or after menopause. If you notice bleeding at an unusual time or after menopause, contact your doctor right away. Changes to your bowel habits can be another red flag. Unusual diarrhea or constipation can be a sign of developing ovarian cancer. You might also notice that you have to pee more frequently or have urinary urgency, a sudden need to go right away. Finding a lump. In some cases of ovarian cancer, you might feel a lump in your abdomen or notice that your abdomen has suddenly gotten larger. Unfortunately, there are no routine tests to screen for ovarian cancer, but you can understand your risk factors and plan ahead with your doctor. Some risks to know about include your family history. If people in your family have had ovarian cancer, it's good to let your doctor know. You can receive genetic testing that might help you plan for a possible diagnosis in the future. It can also be helpful to let your doctor know if you're of Eastern European, Ashkenazi Jewish background, as this can increase your risk. Age. Your risk of developing ovarian cancer goes up the older you get. Pregnancies and certain conditions. If you've never been pregnant or had endometriosis, your risk of ovarian cancer goes up. You are also at increased risk if you've had other cancers in the past, like breast, uterine, or colorectal cancer. Listening to your body and the cues it gives you is really important when it comes to ovarian cancer. When something feels off or outside of your normal, reach out to your doctor to talk about the symptom.